with Dr. Benita Zahn.
Welcome. As we stayed home and away from friends and family during the height of the pandemic, there was an increase in alcohol consumption. Before COVID-19, more than 25% of American adults admitted binge drinking, that according to the National Survey on Drug Use and Health. And this was done in the first few weeks of the lockdowns, though alcohol sales jumped 54% over the previous year. And a September 2020 study in JAMA shows alcohol consumption was up by 14% compared to 2019. So why do I talk about this? It's not about the drinking. You see, of all the concerns about increased drinking, there's one that travels under the radar, and that's the increased risk for esophageal cancer. And April is Esophageal Cancer Awareness Month. And the statistics on it show this. An estimated 18,440 people in this country were expected to be diagnosed with esophageal cancer, and an estimated 16,170 would die from it, making it one of the deadliest cancers. Dr. Ajaz Khan is the medical director for medical oncology at St. Peter's Health Partners, and he's my Health Beat guest. Good to have you with us, Dr. Khan.
Same here. Good to be here.
You know, people don't realize you put it in your mouth and you forget it. You figure, okay, it gets to the stomach, but it's the journey from the mouth to the stomach that we have to be concerned about, because that's where the esophagus is. Let's talk a little bit about why this is such a deadly cancer.
So from the natural history of this disease for years, one of the problems has always been the relative number of patients that are diagnosed at a later stage. So unfortunately for this particular cancer, we see a lot of patients at later stage disease, such as stage 3 and stage 4. And one has to remember the esophagus really is a tube that connects the back of our throat to our stomach. So essentially it's moving particles or food and liquids down from that area into the stomach. And to actually do screening evaluations is very difficult. CT evaluations, ultrasound evaluations, chest x-rays usually are never sensitive enough in terms of doing screening. Mm-hmm. The other thing is, like you had pointed out earlier, there's about 18,000 cases a year. So do we have truly all the numbers that we need to do a proper screening study? And then which are the individuals that we need to identify that are at the highest risk?
What is the link between drinking alcoholic beverages and esophageal cancer?
So a number of the arid digestive cancers that we see, particularly from the mouth all the way down to the stomach, have higher incidences with alcohol consumption. Particularly in regions of the world, such as South America, we see a significant higher risk of these particular cancers infecting the esophagus that can occur there. And the other thing that one also needs to note is smoking also increases the risk, as well as lifestyle. So patients that are obese also have a higher risk of developing esophageal cancer.
And then there's also the connection with acid reflux.
Right. So a number of patients that develop what we call Barrett's esophagus, which is a premalignant condition that occurs in the esophagus from long history, usually of heartburn, develop this ailment, which then can lead to esophageal cancer.
So if we maintain a good weight, if we don't smoke, if we control there's a lot of ifs here, if we control our reflux, and if we limit alcohol consumption, does that mean you're out of the woods, you're not at risk?
Unfortunately, no. You know, the biggest problem that we really face with this disease is we just don't have the number of cases like we have for prostate or breast or lung cancer or even colon cancer. This disease usually occurs not that commonly in our country, but occurs more along the lines of Central Asia, where the original Silk Route was. And there also is some data that continues to show that consumption of heavy consumption of meats, particularly low consumption of vegetables, also can increase the potential risk of this disease. And there's also familial risks as well.
So then it becomes a matter of being alert, I suppose, to symptoms. And what might send us to the physician to say, check it out?
So I think the alarm symptoms, particularly that we are always worried about, is something what we call dysphagia. Essentially, that means, in non-medical terminology, difficulty to swallow, whether that means that food is being stuck somewhere in the esophagus to having difficulty tolerating even the simplest foods, as well as soft foods and liquids. The other thing we also are concerned about is anemia or possible bleeding that can occur from the upper portion of the esophagus. And unfortunately, long-standing history of reflux that continues to get worse, and then weight loss.
So really, it's lifestyle factors, being alert, and getting in, because as you point out, there is no good screening tool for this.
Unfortunately, no.
Yeah. Well, at least you've raised the awareness, and I suppose that's at the heart when it's when a month is designated for awareness, and that's just what you've done, Dr. Khan. Thank you. Thanks so very much for your time. And thank you all for joining us for this edition of Health Beat. For more information on esophageal cancer, check out the link section at WNYT.com. Till next time, be well.